In this eye, vitreous hemorrhage and traction retinal detachment are present. The endoscopic view shows quite extensive pathology. After minimal vitrectomy, the PICC is used to remove membranes from the surface of the retina using the anterior-posterior traction that normally exists. As surgery proceeds, the membranes can be viewed for quite an extensive distance, and so when the surgeon is pulling in one area of the retina or on a membrane, a more peripheral area can be seen at the same time. This would not be possible through the operating microscope, which by definition would have a significantly smaller field of view.